Hey guys, I had a really interesting conversation with a client earlier today, and that kind of extended into a conversation with a coworker, and it's just got my brain going a little bit. And I thought I'd share that with you and kind of get your food for thought and challenge the way you think a little bit. Somebody asked me earlier, is there benefit to touching base with a therapist every so often to look for any type of imbalances or just to have a screening to make sure that I'm not prone to injury down the road? And so much of what we do in physical therapy is reactionary, meaning you come into physical therapy because of pain. I rolled my ankle while I was playing basketball, and now my ankle is swollen and sore. I went for a hike, and now my knee is killing me. I lifted my grandbaby, and now my shoulder is killing me. And that makes perfect sense, right? You come in because of pain and dysfunction. We help you calm down pain, inflammation, strengthen the muscles around that joint to get you back to doing the things that you like to do without pain or without problem. But when we think about services like dental offices or dental practices and medical offices, we touch base with our dentist every 6 months or every year, hopefully, to make sure that we're staying on top of our tooth health, teeth health. We're making sure that we're preventing future cavities. With our primary care physicians or our medical offices, we're going in annually for a screening to make sure all the organs are functioning well and that we're not prone to illness or further problems down the road. So why isn't physical therapy the same way? We have within our profession so many tools, so many skills to assess your quality of movement and look for any types of joint restrictions or muscular imbalances that might lead to a problem or an injury down the road while you're doing something such as hiking or playing basketball or just everyday activities like lifting your grandbaby. So why isn't physical therapy more of a precautionary or a proactive profession rather than a reactive profession? And I think that's really something to think about. I think it would be a great idea for people to touch base with a therapist every 6 months to every year just for a global assessment of movement and function to make sure that everything and every joint is moving the way it should and minimize your risk of injury down the road.